Gillian Keegan is a health minister and joins us now. Good morning.
Good morning.
What do you need to get to and when do you need to get to it in order to get the booster programme to where it needs to be?
Well, we're working on the plan right now and operationalising that. So obviously we took the JCVI advice yesterday and the NHS and the teams in the department are working on that. So in the next couple of days, we'll have the plan. But of course, we know what we need to do is make sure that we have, enough vaccination centres with enough people vaccinating, with the supply of the vaccine all brought together. And it will be similar to what we've done in the past in age cohorts. I'm pretty sure we'll start, we've done 17 million already for some of our older population, but we'll go down in age cohorts.
Yeah, because I'm 41 and I tried to book a booster jab and it says I've got to wait 5 months because I'm not eligible. Asma's 50, she got the same message. Is this a question of we need to wait a couple of days for the system to get online properly?
Yes, the system is still operating on the old rules. So, we took the advice yesterday. That will be one of the things we'll be operationalising, which will be changing that to the 3 months. But the initial thing we do is to get people called up by their GPs, and then we'll open the booking system once we've got that in place.
So people should hold off for a couple of days maybe?
Yes, definitely. Hold off for a couple of days. We will operationalise the plan. We'll tell you what to do. The GPs probably will be contacting people in the first instance, and then we'll let you know when the booking system's open to your cohort.
How much are you going to have to start pausing NHS work to get this done? Because what we're talking about is a vast logistical challenge that you guys have done before, but when you did it before, you probably did have to pause some things. Is there any chance the NHS will keep at 100% while you're doing this, or will some things have to be delayed, like elective surgery or something like that?
Well, we're hoping not. And obviously, the acute hospitals, which is where most of the elective surgery takes place. And also we're setting up 20 new surgical hubs to manage the backlog. Is different from a lot of what happens with the jabs. So a lot of the jabs are given now by the community nurses, so the district nurses, the GPs, the pharmacists, retired doctors and nurses. And also we've had some volunteers in the past, which we may call on again. But, that's the different cohorts really. The acute hospitals previously only really were doing the jabs for patients and for staff. That may be one aspect, but on the whole, no, we're trying to make sure that we put more capacity in the NHS to deal with those electives.
Let's look at where we are with the pandemic with Omicron more generally. The restrictions on mask wearing, the laws on mask wearing comes in today in England. Why is it necessary? What's the thinking here? Is it an economic argument you're making here that it's you have to wear a mask in a hairdresser, but you don't have to when you go to a pub? What's the thinking there?
The thinking is it's more difficult in a pub because you're eating and drinking and you're taking it off on and off all the time as you're eating and drinking. So that's really just the thinking. So, we're trying to be balanced, proportionate. We're trying to introduce a bit more mask wearing in some of those places where, there's crowded places, you're with a lot of people you may not necessarily know, you're moving around, etc. So obviously the public transport is one of those, but also shops as well. But of course, it is more difficult in places where you're taking the mask off to eat and drink. It's that really.
But they do that in Scotland and Northern Ireland. They're countries where they say if you're in hospitality venues, when you're not eating and drinking, you've got to wear a mask, and we're not doing that in England.
No, and there have been times when the devolved governments have done different things on this. But no, we just introduced this for the moment. It will be reviewed in 3 weeks' time. By that time, hopefully we'll have a bit more insight about the variant and how our vaccines work with the variant. But for now we've introduced it in those places where there's more people basically, and they're moving around more.
I'm not just going to shout at you and say, will Christmas be normal? Because I don't think that really gets either of us very, very far, because you don't know what Omicron is going to be like. No one knows. It's still being looked at. I understand that for the next couple of weeks. But in that period, in the meantime, while we're still uncertain of Omicron, we know it's in the country, we know it's being spread in the community. We know there's a potential for it to be bad. We don't know whether it is or not. Should we be changing our behaviour in the meantime? Do you think? Should we, for example, should I not go to a nativity play because I don't want to be in a room with 100 other people?
The only behaviour you should change is if you haven't come around for your first dose, book it. If you haven't come forward for your second dose, book it. And if you haven't come forward for your booster, and you're eligible, then book it. And if not, come forward as soon as possible. All we want, honestly, for Christmas is for everybody to get jabbed.
And so, in the meantime, we should carry on as normal. If there's an office Christmas party tomorrow, we should go to it. If your children are in a nativity play, you should go and watch it. Those things should carry on as normal for the next couple of weeks while you work out if this is bad or not.
Yeah, I mean, keep your plans proportional, keep them in place. You know, take some of the, some of the things like mask wearing seriously. Make sure you're vaccinated. And we'll know more from the scientists in the next couple of weeks. And in the meantime, do everything you can, obviously, to behave sensibly, which many people would anyway. Most people, a lot of people have come forward. We've done 17 million booster jabs now. Many people have come forward, but for those that haven't had their first jab, and I think last time I looked, there was about 4.5 million people who hadn't. Please come forward. Now is the time for you to come forward.
Do you feel that people not wearing masks, if someone goes on public transport today not wearing a mask, is it likely that they'll get fined? Have you asked the police to do more? Will there be more police? Will you be asking the police to act more stringently when it comes to enforcement? Is there an instruction gone out for that?
No, not necessarily, but they do have the powers to enforce. But it's really a last resort. What we want and what we've always wanted is for the British public to buy into what we're asking them to do, and to take, sensible precautions seriously. And to be honest, by and large, they really have done that. So no, we're not the sort of society that, wants people shouting at people or drones or any of that sort of thing. We haven't been draconian. But of course, the police do have powers to enforce.
Gillian Keegan, thank you for joining us today.